Hi, my name is Yelak Biru. I am a 22-year survivor of multiple myeloma. I'm here with Jack Aiello attending the American Society of Hematology meetings here in Atlanta.
And I'm Jack Aiello. I've got 1 year on Biru, on Yelak. So I've been diagnosed 23 years, and I think one of the recommendations we give to all patients is to find a myeloma expert. Have that myeloma expert be part of your team. So we want to talk about how you go about finding that myeloma expert.
And the reason, in my opinion, that you need a myeloma expert is, as a myeloma patient, the longer you live with myeloma, the longer you'll have to find things that are not standard or data-driven. You go from being data-driven to guidelines-driven, and then you'll start depending on the judgment of your physician. So being able to have the right myeloma doctor be part of your treatment team is critical. And to me, the number one thing of being a myeloma expert is being a member of a working group, like the International Myeloma Working Group or the BMT-CTN working group, because that makes the myeloma specialist accountable not only to themselves and to their peers, but also to the science of advancing myeloma treatments.
So Yelak, I'm sure you're like me. You have many patients who look at you as being a long-term survivor, and they say, well, how do I go about finding experts on that International Myeloma Working Group? Or how do I go about finding experts in general? What do you tell them?
I think two places to go in my mind is a support group that you belong to. If you don't belong to a support group, I think you want to find one in your area, or if there isn't one of the support group directors from the International Myeloma Foundation will be glad to help you form one. But then you can also call the IMF info line and be able to get recommendation on who your myeloma expert can be. Any other suggestions?
Myeloma Crowd has a nice listing of myeloma specialists, but I wholeheartedly agree with you that maybe the best place to go is that local support group, because there's a good chance that support group leaders and other attendees there have seen myeloma experts locally. It's always nice to find someone locally, and the good news for us patients now compared to when we were diagnosed 20 plus years ago is that there are a lot of local experts available to us.
And Jack, the other thing I think we want to find out when we select our myeloma specialists is what is their personal and even maybe their hospital affiliation biases.
So those biases are sometimes hard to find, but it's possible. For example, the IMF website has lots of video blogs from these myeloma experts, and you can get a sense of what they feel about in terms of treatment regimens and such. Again, your support group, if it's a local myeloma doctor expert, can help with knowing what treatments those patients have gone through at that facility. So there are ways to discover that. Ask around. There's a lot of help out there in terms of understanding myeloma expertise and who those experts are and what their biases are.
And I think the other major thing for myeloma expert-patient relationship to work properly is the myeloma expert ability and willingness to individualize treatments. You may not be able to personalize treatment yet, but I think you can find ways to individualize treatment.
Now, what about that myeloma expert that I want as part of my team, but he or she doesn't live locally? How important is it that they be able to work with your local oncologist and be part of that team and help direct that local oncologist, and on the other side, that local oncologist being able to accept those recommendations?
Yes. As somebody who is remote, a myeloma expert, I think the other thing they need to be able to have in my mind is heart of a teacher, right? Because the field of myeloma is evolving, your own myeloma is evolving, and being able to teach you and work, as you mentioned, with your local oncologist, and in some cases help them come up to speed is very critical. What do you think about social media presence of a myeloma expert?
I am amazed if you go on social media how easy it is to follow these different myeloma experts. They are out there, they're providing suggestions in terms of treatments, they're providing updates from ASH here. And it's a great way to also learn a little bit more about them through their tweets, learn perhaps a bit more about them, about their biases. And I think it's a great venue for learning more about that.
So in closing, we both agree that as a long-time survivors, selecting a myeloma specialist that fits your needs is important.
It certainly is, Yelak. And I'm so pleased at ASH to see all those myeloma experts here. And their video blogs will be up there on the IMF website and give us the latest information about what's been announced here. And the fact is, they are really willing, the ones that we know are so helpful to patients, can be so available to patients. I'm really pleased to be part of this community.
Thank you.